Welcome back. 8:27. The pandemic left morgues across the country overwhelmed and overworked. But even as COVID deaths are easing, morgues still need that extra space because of an overwhelming amount of people that are being killed by fentanyl.
Opioid-related deaths have nearly tripled in Cook County since 2015, and coroners say it's tough to keep up with the bodies piling up. So here to talk to us about this issue is addiction and fentanyl expert Nicholas Mathews. Thank you so much for being here with us this morning.
Sure, thanks for having me.
You know, when we say bodies piling up, I just want to, keep in context. These are mothers, fathers, sisters, brothers, children, and older adults. And a lot of people don't even realize what fentanyl is and why it's so lethal. Can you talk about that?
Yeah, absolutely. Fentanyl is kind of the newest, latest and greatest opiate, if you will, in a long line of opioids that we see people abuse. I think, as a lot of the traditional medications that we would see, oxycodone and things of that nature, have started to become more and more restricted, there's been a market of these synthetic opioids that have kind of rushed in and are taking lives at an alarming rate.
And so why all of a sudden are we seeing this massive uptick? Because as we stated earlier, it really is overwhelming, the number of people who have died as a result.
Yeah, I think it's interesting because, again, I think it's because there's a market here, right? What we saw was this huge push of regulation and awareness of what traditional prescription opioids were doing. Again, your oxycodones and your oxycontin. And so as those medications became more regulated, treatment options didn't, increase at the same pace. So now a lot of people that had been addicted or had experienced addiction as a result of taking these medications were left without any solution other than now you can't have your meds anymore because we're now aware of what it does to you. And so there was this entire push of addicts that weren't your traditional, maybe, street level heroin addicts that you might imagine in your mind. These are just average, hardworking Americans that are now left with an addiction caused by the pharmaceutical companies with no solution. And hence the market is created.
And we talk a lot about Narcan changing the numbers when it comes to overdose deaths, but there's been a lot of controversy when it comes to fentanyl test kits. In just the last year, Chicago has distributed more than 50,000 of them. How can it help curb overdoses?
Yeah, I understand the controversy because you kind of can assume that you're facilitating people, using these narcotics. But at the end of the day, what we're seeing is that, prohibition isn't working, and we have to try and reduce this harm. So allowing people to test their substances, we have to accept the fact that they're going to be using these substances regardless, as evidenced by the number of deaths we're seeing related to overdose. So providing them any resource, be it Narcan or the test strips, to keep them safe in those moments is wildly critical while we try and work on a grander, more long-term solution.
Nicholas Mathews, thanks so much for joining us this morning. This is a big conversation going on across America right now. Let's hope something can be done to make sure these deaths are not continuing to increase. We appreciate your time.
Thank you.